In this video, I'm going to talk about stimulants and hallucinogens. So first off, we're going to talk about stimulants. They are agonists for dopamine, so they increase the level of dopamine in your system, and they give you a feeling of euphoria. They also increase noradrenaline, which gives you energy as well. The stimulants we're going to talk about are cocaine, methamphetamine, Ritalin, and dexedrine. There are some synthetic stimulants that have been around that have been coming in from China. They used to call them bath salts and flocka. We'll talk a little bit about them. This MDMA is Molly or ecstasy, and it's actually both a stimulant and a hallucinogen, so we will talk about that. And then we might not think of caffeine and nicotine as stimulants, but they definitely are. So all of these drugs create what we call psychological dependence, which is just based on emotional needs or desires, wanting to escape or feel better. So you don't have the physical withdrawal symptoms that you do with a depressant. It gets out of your system within a few days or up to a week sometimes. So there's no physical withdrawal symptoms. But especially with cocaine and some of the stronger methamphetamines, often people feel pretty severely depressed when the drug effect wears off. And that's one of the reasons why they seek out that drug again and again. So these are some examples of psychological withdrawal symptoms. And if you've ever tried to cut back on caffeine or stop smoking, some of these might seem kind of familiar to you. Irritability, trouble sleeping, depression, restlessness, headaches. All of these things can occur when you stop using a drug, and it may last for days or weeks, these symptoms, but they will eventually go away on their own, and the drug will get out of your system pretty rapidly. So cocaine is one of the most expensive stimulant drugs out there, and it's not quite as common because of the expense of it. So cocaine increases the level of dopamine and noradrenaline, giving you this euphoric feeling. Creates 10 times the normal level of dopamine. And when it was discovered, and I'm trying to remember, it was like in the 20s or maybe even earlier than that, in Freud's time, so maybe early 1900s, they thought it was a miracle drug as well, and they thought it was a great treatment for depression. But then they suddenly quickly realized that the effects wore off really quickly. So you felt really good for a few hours, but then it goes away pretty quickly. Cocaine was actually added to Coca-Cola, and that's where Coca-Cola does get their name. When Coca-Cola was produced, and I think it was like 1900 and something, I should look that up. When it was produced, they did add a small amount, trace amounts of cocaine in there to kind of give people a boost when they drink their Coca-Cola. Today we have caffeine in there, so they substituted the caffeine for the cocaine after they realized it was problematic. But prior to that, it was originally in Coca-Cola. So cocaine causes extreme psychological dependence, increases your anxiety level, interrupts your sleep cycle, and the effects only last 1 to 4 hours. So once those effects wear off, you can feel pretty depressed and worse than you felt before you used it. And it is the most potent natural drug. It's highly, highly addictive. Crack is a synthetic form of cocaine that can be smoked, and when you smoke it, it actually reaches your brain much more rapidly and it even becomes more addictive. So crack cocaine is a pretty addictive, highly, highly addictive substance. So synthetic stimulants include methamphetamines and bath salts. Methamphetamines we're going to talk about in the next slide here, but these are made from synthetic substances. Bath salts were something that were brought over from China, and they were packaged like they were really bath salts, but they actually were a synthetic stimulant. And part of the thing that China has been doing is creating these drugs that mimic the effects of different stimulants, but they don't have the exact same chemical properties, and so they can actually get past customs, and because this particular drug compound hasn't been made illegal yet, they have gotten past that. So in 2012, these bath salts were made illegal. Spice is synthetic marijuana that you used to be able to buy like over the counter because it wasn't illegal because it wasn't an exact substance. There wasn't an exact law to prohibit that particular substance. So MDMA is a synthetic stimulant and hallucinogen. It was originally created as an antidepressant medication and wasn't really successful in treating depression. depression. It does increase your serotonin level, which we know affects your mood, and it does increase dopamine and norepinephrine, and it creates this euphoric feeling. So, and then it also is a hallucinogen. So we'll talk about that when we talk about hallucinogens. So methamphetamine abuse is definitely something that has been talked about. There have been campaigns to try to help people stop using methamphetamine because it is really detrimental to you physically and psychologically. So people that use methamphetamine often have paranoia. They have psychotic symptoms where they see things that aren't there and hear things that aren't there. They also feel things that aren't there. And if you look at these two young girls that were very, very pretty, and then you look at them with all these cuts and marks all over their faces, you think that's acne. But what it actually is they are hallucinating that there are bugs under their skin, and they're actually picking at their skin to get rid of the bugs underneath their skin. And this is really common with methamphetamine abusers. And you see that all over their body as well. So it can definitely cause you to have some pretty strange symptoms. Increase your anxiety level, definitely plays with your mood, brings your mood up and down. And people who use a lot of methamphetamine can become really violent and aggressive, really dangerous people often on methamphetamine. Users have really extreme weight loss because they're not eating. Often they have severe dental problems because they have really poor nutrition, and your body actually takes the calcium from your teeth to survive, and you get sores from picking at the skin. So this is a really mild picture of meth mouth. This guy had beautiful teeth, and now they're rotted out, and there's no real fixing that. So there have been a lot of campaigns to try to discourage meth use, and it does appear to be working. Methamphetamine use has dropped. This is a picture from one of those campaigns, and this is a young girl, and it looks like it's 1983 and 1997, so 14 years later, 14 years of methamphetamine use, and how it's really aged her and messed up her system, and a lot of that she's not going to get back. So can you actually overdose on a stimulant? And actually the answer is yes. Overdosing on a stimulant can cause violent behavior and aggression. And you see sometimes with police officers having to arrest people that are high on meth, they can be extremely violent and aggressive and really difficult to manage. And they have kind of superhuman strength as well. If you do overdose on a stimulant, it can also cause seizures, heart attack, coma, and death. So too much of a stimulant is definitely highly, highly dangerous. Ritalin, Adderall, and Dexedrine are medications for attention deficit disorder, and we might not think of them as drugs that are abused or illegal drugs that are abused, but unfortunately, there are parents that abuse it, and it's also sold as a street drug as well. So it is a stimulant, and it acts like a stimulant, and it does increase activity in the frontal lobes of the brain. And that's why it works for attention deficit disorder. So when kids have attention deficits and or adults have attention deficits, we used to think that kids grew out of attention deficit as adults, and now we know that that's not actually the case. And so when somebody does have attention deficit and they take a stimulant, it has a different effect on them than it would us. It doesn't have that same high that you would normally get from a stimulant. What it actually does is help activate the brain. So it helps activate the frontal lobes of the brain, and it helps with impulse control, being able to focus, and better judgment. So it's why it's helpful in treating ADD. So it stimulates the activity in this part of the brain. And so it's very useful. In a person that has attention deficit disorder, it has an opposite effect. So the hallucinogens are a group of psychoactive drugs that produce hallucinations, and they can be auditory, where you hear things, visual, where you see things, or kinesthetic, where you feel things. It distorts your sensory perceptions, and you can have alterations of mood and different distorted thinking. Different hallucinogens are LSD, marijuana, Molly, and then also mescaline is brought up in the book, which we might call peyote. Native American culture calls it peyote, and it comes from the flower of this particular cactus. And I don't know if the medical term for it is mescaline, but it has similar effects as marijuana. and it is a hallucinogen. So hallucinogens create distorted perceptions of reality. They skew the whole perception of the passage of time. You may have visual hallucinations. You might also have kind of distorted bodily perceptions, like you might feel like you're a giant, or maybe you feel like you're small. So hallucinogens do appear to have less addictive properties than other drugs. They are not, they don't create physical dependence in any way, but they can create some psychological dependence. So Molly actually decreases activity in the amygdala and reduces the fear center of our brain. It's a combination of an amphetamine and a hallucinogen, so it gives you energy and then it also gives you a hallucinogenic experience. People that use Molly can get into trouble mostly because of dehydration and overheating. It causes your body temperature to rise, and often people are kind of out of it when they're using Molly and they don't pay attention to these symptoms. Psychologists and medical professionals are actually looking at different hallucinogens, including Molly, for treating PTSD and depression. So it's kind of interesting. So this is an example of what LSD might look like if you were to take it. You put this stamp on, you cut this out and put this on your tongue. However, some people have overdosed on LSD and really can have a pretty horrific bad trip on LSD. And there is this thing called the Zendo Project, which is psychedelic harm reduction. And they actually have tents set up at different events and festivals and concerts to help people who are having a bad trip on an LSD or a hallucinogen. And if you've overdosed on a hallucinogen, the only thing you can do is really wait till it gets out of your system. So they have cots in places where people can sit down and get through that bad trip, but it could take a while for it to get out of your system. So the ability to study illegal drugs, their benefits and long-term negative effects has been really difficult because they're illegal, and to get permission in order to study these particular drugs is really difficult. So it's been problematic, especially in studying marijuana as well. So this is just a cute image of what it might look like if you are on an acid trip and you've taken LSD. So marijuana is a mild hallucinogen. So a lot of people question whether it's a hallucinogen at all because you don't have an acid trip like you do on LSD or Molly, but it does distort your perceptions. And the active component in marijuana, is THC. And it remains in your system for months. And that's one of the things. You could use marijuana at a party a couple months ago and go in for a drug test, and you're going to test positive for marijuana because that THC is still in your system. So you're no longer high from the marijuana, but it's still in your system. Spice was a form of synthetic marijuana that you can't get anymore either. It was another drug that was also coming over from China that was synthetic marijuana, and it was in really high doses, and it caused people to really become zombied out on that medication. So marijuana is a mild hallucinogen. It's the most commonly used illegal drug, causes changes in perception, and it is unusual in that it raises the heart rate like a stimulant, but it slows other things like a depressant. It causes changes in the reward center of the brain, so it increases that level of dopamine, and there's just a lot of debate about the effect of long-term use. There are concerns about changes in motivation, memory issues, reduced sexual function, and that THC remaining in your system for months, we don't know what that does to you. And there's a lot of concern about brain development when it's used by adolescents because there's a huge amount of brain development that's occurring at that stage. There's a correlation between marijuana use and schizophrenia. However, it's not really clear. I would definitely not say that marijuana use causes schizophrenia. There has not been an increase in schizophrenia, and there definitely probably has been an increase in marijuana use, but there are people with schizophrenia and other psychological disorders that abuse drugs and alcohol to kind of try to relieve their symptoms. So do you think you can overdose on marijuana? Well, you actually can, and you can feel pretty miserable if you do overdose on marijuana. Nobody's ever died from a marijuana or overdose, but you can still feel pretty miserable. So you can have increased paranoia, extreme anxiety, increased heart rate. They call that green out when you have an overdose on marijuana. It usually occurs when you've eaten it rather than smoked it. So if you eat an edible, a lot of times you can get too much marijuana in your system and you don't realize it until it's too late. And there is increased impairment when you mix it with alcohol, and the effects can last for days if you overdose on marijuana. So you want to be careful with that. You also want to be careful about combining marijuana and alcohol. Alcohol increases the absorption of THC from marijuana, intensifying marijuana's effect, and then it's decreases the effect of alcohol initially, and it might prevent the person from realizing how intoxicated they are. So it can increase the risk of alcohol poisoning. Marijuana also inhibits vomiting, and that's why it's used in chemo treatment and AIDS treatment as well. So you can get into trouble when you need to get rid of that alcohol in your system. So would recommend not combining alcohol and